access. So we could look at that as well.
A couple things too.
Part, he's done, that's, maybe that's just the runners. But he's gonna get us an estimate and everything, we can have it come up with some answers. So, we have more than a second.
So why don't we go ahead with this and then we can modify it?
We gotta get an occupancy, right?
Great.
Okay, so we have a motion and a second, and we discussed it, everybody, all in favor, say aye.
Aye.
Those opposed, nay. Motion carried.
Resolution number 129, offered by Public Safety.
Motion and a second.
Yes.
Any discussion? All in favor, say aye.
Aye.
Motion carried.
Number 150, by Economic Development, related to schedule for data.
Motion and a second. Ed, Wendy, any discussion? All in favor, say aye.
Aye.
Those opposed, nay. Motion carried.
Resolution number 151, offered by Public Works and Services Committee, relating to authorization for the county manager of Franklin County to sign an agreement between Franklin County and the state of Connecticut to the United States Code for a project described as operating system.
Motion and a second. Paul? All in favor, say aye.
Aye.
Those opposed, nay. Motion carried.
Resolution number 152, offered by Human Resource Committee, relating to authorization to accept civilian funds. Contract.
Okay, motion and a second. Good. Okay. Any discussion? All in favor, say aye.
Aye.
Opposed, nay. Motion carried.
Resolution number 153, offered by Public Safety Committee, relating to authorization to
Motion and a second. Paul? Any discussion? All in favor, say aye.
Aye.
Those opposed, nay. Motion carried.
Resolution number 154, offered by Economic Development Committee, relating to Lake.
Motion and a second. Ed, Andrea? Any discussion? All in favor, say aye.
Aye.
Opposed, nay. Carried.
Number 5, offered by Human Resource Committee, relating to authorization to follow place of place rate of
Good. All, any discussion? I think this is public comment.
Katie, can you just speak to the savings by combining a couple of positions?
Yes, by putting this in a package of sorts, what this allows us to do is use the supervising community health position and our preparedness grant, as the tasks are going to be melded into the one job, which means we picked up the responsibilities and the tasks because it also added responsibilities onto the job. When all is said and done, this is a position that will cost from it. What's left after direct grant funding is $20,000, and then of that $20,000, 100% is eligible for Article 6 reimbursement.
So it's about a $45,000 savings.
But if you help your department too.
Yes, we absolutely needed that high level, high functioning to be able to do more things. Yep, absolutely. So we're happy it even saves money too.
Yeah, well
It's
done.
almost a plus. discussion? All in favor, say aye.
Aye.
Those opposed, nay. Motion carried.
Resolution number 156, offered by Community Resource Committee, relating to authorization to accept public park appearance/response to Byron Cherry's public house.
Motion and a second, Andrea. Any discussion? All in favor, say aye.
Aye.
Opposed, nay. Carried. So we have, is there anything else to come before the board? Okay, so, your question to adjourn, and we'll, please, Paul, Ed, all in favor, say aye.
Aye.
So, ready for our, we're behind a little bit, but we're ready for our alarm. Thank you, Katie, for coming.
Thank you.
I don't, yeah, we're ready to do that.
Katie,
It's clean, I promise.
Well,
can you close the door, Katie?
James is handing out a summary. Just want to thank everybody for allowing us to join you to give you a little update on our project. I'm Nick Eels, just for anybody that doesn't know who I am. I'm currently the chair of the board of Citizen Advocates. With me is James Button, our CEO. I'm not really going to do any of this. I'm going to let James take it. He can give you some details that I may not be able to, so I'm just going to hand it off. Is that okay? Good morning, everyone.
Morning.
Can you hear okay, Paul, Suzanne, EJ?
Fair, fairly, fair.
Oh, it's fair.
Yes, I can.
I'll try to speak up. Good morning, everyone. As Nick mentioned, Nick Eels is the board president of Citizen Advocates. My name is James Button. I am the chief executive officer. I've worked with many of you throughout the years as I've come up through the ranks at Citizen Advocates, so I'm grateful to be in a position to speak to you on behalf of the organization today. We did want to come to the Franklin County Board of Legislators to give a brief update on the Harrison Place project. I know that's been a focal point of the Malone revitalization effort for a couple of years now, and it's a big project with a lot of promise. You know, when we went into this project, we knew that this project was larger than Citizen Advocates. We knew that this was going to take the entire community to come together around the hope and the promise that this project, this project provides. It's slow moving. It's a very long project, multi-year timelines, and there are times in the project where there's not a lot to update on. So we've gone through a period of that, and to be real transparent, COVID has changed the way we think, the way we plan, and many of our plans for the future. So we wanted to see how COVID would impact the North Country before we made our next step with the Harrison Place downtown revitalization. But after several months in this new normal of ours, we've decided to move forward and reaffirm our commitment to the project. We recently, in the last month, I'm not sure if the community is aware, but we did put up the construction wrap. A lot of folks thought that we already owned the buildings. In fact, we did not. We had purchase options on each of the buildings, but last month we triggered the purchase of all 8 properties. That's all properties on that block, including the back lot, except for what is currently housing a bath and tile shop. So those are all in Citizen Advocates' possession. The update today was that we've acquired the properties, and we have amassed almost $6 million currently for the project. project has a long way to go because it's calculated to cost between soft and hard costs about $25 million. So we've got 6, we need a little bit more, and we're working with Homes and Community Renewal, as well as Homelessness and Housing Assistance Program through the Office of Temporary Disability Assistance. Try not to use any acronyms. So we're going around, we wanted to engage our municipal and county partners. We gave an update at the town board, given several updates to go forward, working very closely with the village. And now we're coming to the county to give you an update. We're also coming to the county to answer any questions you have about citizen advocates. Again, reaffirm our commitment to the Harrison Place project, but reaffirm our commitment to Franklin County at large. This is our home, this is our headquarters. This is where many of us have grown up and lived, and Franklin County is important to us. That said, we're asking today for a letter of support from the county in the form of a letter from DSS endorsing the project. We recognize that a letter was given prior to this, and we actually chose not to use the letter because there were contingencies in it. So we are coming back and we are trying to we believe some of those contingencies have been resolved. I'm happy to talk more about it today. But if we could resolve any concerns, questions, or contingencies the county has, we respectfully request a letter of support for this project.
I don't know what our recommendations are, but I'm sure that Michelle, you had some, I think.
Yeah, I do have a couple questions, if that's okay.
Sure.
One question I have is that I know that previously, like last year, you were had applied for the grants as well as far as the Harrison project. Has any your grant proposal, has any of those things, has anything changed within the grant proposal from 19 to 20?
Other than the amount of money that Citizen Advocates is directly investing, no.
So the services that you had originally had thought and the units, I guess I can't remember, if you could just let me know that, I believe that there was a breakdown because it's a 40-unit facility, correct?
Yes.
And was there a certain piece that was going to be utilized for certain programs? Because of the way the funding was driven.
Yes, there's half of the housing is through a supportive housing grant.
Mm-hmm.
The other half of the housing, the other 20 units is low-income housing.
So no diagnosis is needed. 20 of the apartments need to have basically a mental health diagnosis and, right, and meet a certain criteria. And the other half is open to the public as long as they meet an income criteria. Is that?
Yes,
Yes.
that's correct.
And just to clarify, is it just a mental health diagnosis and not a substance abuse history or diagnosis?
It could be.
It could be.
Okay,
both.
it could be one or the either. It doesn't need to be
Right.
Yes, and I think it's important to clarify because I don't know of a single household in our community that doesn't have someone struggling with either addiction or mental illness. It does not have to be the person on the lease. It could be a family member. So a child in the household might have addiction issue and that would qualify the family for a rental.
It's been my experience. It's almost sometimes we get hung up on the other side of it that they don't have. Maybe have lots of maybe mental health, but they don't necessarily have an SUD piece. So I just want to make sure it could be one or the other, not just a hang up on something like that.
Sure. No, thanks for the question.
One of the things that we had talked about last year, and I know that I think that it was across the board that we had some concerns about. Some had been clarified and I think fixed. But as far as one of the main concerns that we had was Franklin County residents having priority and or having, there's certainly a huge need within Franklin County to make sure that those people are utilizing the supportive housing versus people that are coming in who have maybe perhaps utilizing the crisis center and then being placed there and or other people coming from the outside of the county. Can you talk about that?
Sure. I just want to I want to be clear that our objective is the same as the county's. We would we'd like to meet a need in Franklin County. Fair housing laws do not allow us to assure that that is going to occur, but reasonably stated, the need is here in Franklin County. We want to solve that need. So I really want to be clear that we can't say that we will prioritize Franklin County people in these homes, but there's such a waiting list of Franklin County people. We'll certainly be reviewing it. I don't want us to get hung up on this. I understand the concern. It's a concern of ours. We serve a ton of people from Franklin County. We serve a very small amount of people from outside of the county. And actually, many of the people that we serve from outside of the county actually come to us through they don't come to the county because of us. They come here per se at the casino. We get a lot of calls from the casino for people who need services and support. Our catchment area for the Crisis and Recovery Center, I know that that's probably the unstated magnet for out-of-county services. We thought when we modeled out the Crisis and Recovery Center that it was going to have a much larger catchment area. What we found is that most of the people we serve are from Malone or the surrounding communities. There are people who come occasionally because they've heard about our services and it's one of a kind in the North Country, but largely it's Franklin County residents that we serve.
How do you prioritize admission? Is there a process as far as if you've got 40 units and you get 100 applications, is there a process as far as prioritizing those? Is there a committee that's reviewing applications? Are the 20 units going through SPOA, the single point of access? Just curious about that.
Donna, I can't answer that
Okay.
question, but I will get back to you on it. There may be two different, I'm thinking there may be two different processes, like for low-income housing and standard.
Right, well, so they all have to meet of low-income housing? All 40 units?
I think there's two sets of rules.
Okay, that'd be great, it doesn't, out of curiosity and just
Sure.
for
I
information
just don't want to
purposes.
misspeak.
Right, like, yeah,
No, and I think that will actually be helpful because, like PSS will probably be driving a lot of the referrals, eventually coming down the road as far as the housing. So it would help to know like what the referral process would look like and,
how you
who
select.
I would say, put referrals in.
I agree. In fact, we want to work hand in hand with DSS. All of the people you serve, we serve as well. So it really makes good sense. So I'll get back to you on that.
Do you have more?
I do. Sorry.
Oh, keep going.
Let's see. What else do I have? So can you identify for me or for us some support systems? Or it might be too early on in the process, but like I'm thinking like overall like some support systems and or wraparound services that you are going to be putting in place or proposing to put in place for the residents that are going to be within the property.
Sure, I can talk about a few specific services and supports. Beyond that, Citizen Advocates has a whole portfolio of services and supports that we would wrap around folks in the community that we currently use. But specific to this project, we will have a property management group that plays the same role as like a superintendent and an apartment manager. But in addition to that, we'll have supportive housing case managers who are staffed and actually located on site. It's a Citizen Advocates property, so we will be well in tune with its upkeep, maintenance, and needs in terms of the visible portions of the building. It's likely that we're actually, I know this was a concern before and a question in and around local businesses. Who are we bringing into the commercial spaces? We actually have letters of interest for all of the commercial spaces, and they're all local entrepreneurs, local business owners. Some of them provide services already. We have a WIC program that's going in downstairs, or at least has given us a non-binding letter of commitment. So we look to wrap services around this project, this group of folks that we are bringing in to house here. We also have been in talks with a couple of local green markets. We want to bring businesses to this community that not only help the community, but also help the people that we're facing.
Is the property management group, the housing care case managers, are they 24/7?
We'll have 24/7 services for people who live in the housing, but I want to make that clear. We have 24/7 services now. The supportive housing case managers will be daytime staff, but then there's an on-call crisis center or crisis system. There's we have mobile crisis teams that can dispatch. So we have a significant layer of support that we're going to wrap around folks.
Will there be 24/7 on-site support, like somebody there managing at all times? Or be present, like if somebody needed something or for security purposes, would there be somebody on site at all times?
I have to get back to you on that.
That's okay, it was just.
I don't believe so. I think it will, well, err on the side of caution, say it's a daytime position, these positions. What makes this difference is that there will be a group that is charged with the responsibility of maintaining fixed asset, which is managing the property, and then there will be a care team on site as well.
So I believe the concern is if there is any disruptive issues or aspects of conflict, and how is that going to be dealt with that are in the evening hours?
I think the mayor was going to, the mayor part of our legislature, they're probably going to bring that up after.
No, you go ahead.
What we would deal with them, or we would ask that we work together with the community to deal with them as the community currently deals with them. We have more mental health and addictions and support services in Malone than we do anywhere else in the county, and possibly even in the North Country. So I think that we're well positioned to manage this. I feel even more confident because, again, we're headquartered in Malone. We're your neighbors. We're also North Country folks. We care about the community. We care about what happens to people in the community. So we're very focused on making sure that this is managed well, and managed to the expectations of our external stakeholders.
A couple more, I promise. Will there be any community partners that you'll be collaborating with in this partnership? Aside from, I know that you guys have Citizens Advocates has a lot of services in-house. Is there anything that you're looking at throughout the community for partnerships, and what those would look like?
Sure, we're in talks with actually some of the community partners that we are already in talks with include CP of the North Country. They're the folks who have discussed putting a WIC program in the building. We're also in talks with other physical health providers around whether or not it would make sense to put a primary care practice in the building, as well as I said, a green market, which would provide fresh, fruits and vegetables year round. We're trying to make this a whole health approach.
Some of the ones partners that I was thinking of too, James, is HUD. Have you been in contact with Eileen Gillen in that group? Would that be something, because I'm assuming that you'll work closely with her as far as like some of the people that will be able to low-income people recipients of HUD for the facility?
Yes.
Okay.
Yes, we're in close contact with them. And I know that there was a question about whether or not Lindsay Hendricks is still with the project. She is. We were in touch, and she is actually in touch with Suzanne Levine to give updates when requested. So she's really focused on those relationships, the low-income housing relationships. But we've even sought counsel and advice from the Saranac Housing Authority, or Harry, I think it's there.
Yes, I think actually, yes, Lindsay is part of the COC, right?
Yeah.
Eileen Gillen, I think it has a local CO, is part of one here too, that would be helpful. Others that I had thought of too, for partnerships would obviously be DSS would be one that we would be, working with, and another thought for transportation with, because with Franklin County Transportation, I didn't know if there was any, thoughts or what, if you were doing something individually regarding the transportation. I know that the project is pretty much centrally located and able for, residents to be able to access services local, but didn't know if there's any, thoughts about transportation and what that would look
I
like.
think that those are all great ideas. I think that they all make sense. Any kind of partnership that would make more convenient the act of staying well in our community would be welcomed by citizen advocates. In fact, we look at helping people stay well in our community a little bit differently. We've tried all these different incentives. We just want to make it convenient.
Can you talk a little louder? Suzanne's having trouble here.
Hi, Suzanne. We just want to make being well in Franklin County a convenient act. I mean, there's so many hurdles to staying well across the nation. We want to make it super convenient to be well.
So a bus stop somewhere around the building might be an option, speaking with our public transportation, whether it's behind, something,
It wouldn't be a taxi service, but it could be a stop.
What's that, Don?
It wouldn't be a taxi service, but it'd be a
A
stop.
bus stop, yeah.
So I know that there's actually been, a lot of turnover within the senior leadership at Citizens Advocates. I guess I just wonder if that turnover, or how has it impacted this project in either, whether it be positive, negative, or what that might look like, what do you think?
There has been a number of leadership turnovers in Citizen Advocates. We're a small town, we're a small community, so I'm sure that any changes at one of the major institutions doesn't go without notice. I want to be clear, candid, and transparent. We went through a transition over the past couple of years, and we are on a good track at this point. Our leadership team is made up of people with local ties and people who have been with the agency for a long time, myself included. Citizen Advocates for 13 years. I grew up in Kent. In addition to myself, our leadership team involves Carrie Johnson, who's been with us for 30 years. She's our vice president and oversees all of our clinical services, all of our programs. Heather Perrin is our chief compliance officer. She grew up in Rushton. Jennifer Dishaw is our chief of staff. And then Kana Teig has recently joined our team. Kana used to run Total HR, and she's actually joined Citizen Advocates as our HR executive. So the one hole that we have in our leadership team is a chief financial officer. But we recently hired a woman named Mary Ellen Dean as our controller. I put her in touch with Suzanne Levine and Ara to make sure that we're getting our reporting on track. Our reporting is way behind, just super transparent. I understand that that's a concern. It's a concern for us. We're appreciative of Mary Ellen Dean. She actually came from an IDD provider, provider of intellectual and developmental disability services in Plattsburgh. She lives in West Jay-Z. I think one of the things that you will see for us, Citizen Advocates, is though we appreciate folks from outside of the region coming out and bringing their talent and their ideas to Citizen Advocates and benefiting our community. We've largely seen a number of people come and go after relatively quick tours in the North Country. So we're really focused on not only recruiting, but also retaining local talent.
How many additional jobs do you anticipate?
From this project?
Yes.
7.
7. We always like to hear about the jobs, right?
Sure. Not only 7, I think that the bigger impact, economic impact on the community is that we will source whatever material we can locally. That's a big deal to us.
Need oxygen.
I'm just I'm thinking as you had mentioned a couple of your places down below that were going to come in, or like some green places as well. Is there an idea or thought about having some of your residents be able to be employed in some of those?
I mean, that idea has come up. We are currently, Citizen Advocates has working relationships with 25, what we will call friendly employers, people who would like to employ people with disabilities, give people a second shot. That's something that we can talk about with the businesses underneath. I think our strategy and our focus has been to bring in businesses in the downtown that didn't necessarily compete with local established businesses, but also provided some benefit to the folks who are living above them. So that's why you keep hearing me repeat, green market, some kind of, maybe even a farmer's market, or a Nori's type establishment. Wouldn't that be cool for Malone and for the people who support the services? Physical health, maybe a primary care, WIC, food stamps, things like that. So that's something that we're going to have to look for advice and feedback from the county on who wants to partner with local providers of services. Perhaps even the county would like to establish a little satellite in the building. Many of those people that we house there are also your clients.
Suzanne, do you have anything?
Thank you, Don. Not right now. Certainly, James and Nick Ells joined the CSB on Tuesday. They provided us with some information regarding changes in leadership and different areas of concern, particularly in contracts. They've gotten us up to date. I think I'm good with what James has shared, as well as the questions Michelle's asked for clarification.
Thank you.
So I just have a question. Have you had a chance to sit down, and I know this is down the road before you have any, before it gets occupied, but we're all thinking about the virus, right? And so have you thought about what kinds of things you'll put in place, or are there going to be requirements around the ability to have access to, how do you sanitize and those kinds of things? Just,
We haven't gotten that far yet, but I did want to make it a point to perhaps invite Michelle. Suzanne's already accepted an invitation, and Donna, if you're interested. We have a bi-weekly Air Police Committee meeting. It's heavily focused on funding and building, but this project has taken several, it's evolved. So when we were first got together, we were talking about what's it going to look like. Now we're focused on funding and timelines for construction and demolition. As we start to get that off the ground, it'll really focus on what does this look like in terms of services and support. Not only would you be able to contribute to the discussion, but you'd also be able to stay in the loop on what we're doing.
I would like that, especially on also my director of financial assistance, Janelle Reno, who's well versed in working with homeless and all of that population. I think that could bring a lot to that table.
Great. I think Suzanne has agreed to join us, and I wanted to extend the offer.
when is there a specific day of the week?
Yes, it's Wednesday mornings. I think every other week, Wednesday mornings at 8 a.m.
Because Thursdays usually don't work.
8 a.m. And it's sometimes just a half an hour long, and even sometimes it gets canceled because this project at times slows down, so there's nothing new to report.
Is it in person right now, or is it virtual?
Yeah, in person or by phone. We set up Zoom
And where do you host it?
at our administration building.
I just didn't know what kind of space. I'm
Yeah.
really about the space right now.
Oh,
I'm sorry, Ed, but you know it's our world around public safety.
We would also say the more the merrier, but we do have a small space
Okay.
and a lot of people
You'd
choose.
rather they-
So virtual is that, joining in through,
Yes.
perfect. But I have to ask the question, right? So
Oh, that's
I
great.
can't be shuffling in my chair all the time.
Well, we've changed how we do business, everyone. So we're just grateful to be in a position. We've been really concerned about COVID. I mean, it's on everybody's mind. We're concerned about long-term viability for the agency. We're concerned about the project moving forward.
We just worked so hard, in Franklin County, as, you know, but just the team's been amazing to try to keep our numbers down. So it's always my, you know, I go to bed thinking about it, right, and I wake up thinking about it.
We go over each, let's let everybody have something to say, probably some are gonna have more than I do, for sure. Paul, do you have anything?
One thing you mentioned about the stipulation of being Franklin County residents at carpooling. And how does that hinder, or how does that put you at a disadvantage as far as this program moving forward? Or what's the reason behind you won't use the letter?
Because it's something we can't create for our funding. We cannot say that we will put priority status on some geographic location. That's not, we're here, we're committed.
What's the hinder your funding?
I think it's housing law, so.
It is
Yeah.
housing law.
What did you like to be able to say? Just kidding. Greg?
I have no questions. I just think it's a great thing with President Maloney and Franklin County. So you spoke to that before. That button was full. I think it's great. You can go.
We've met several times with James and his team, and I know for the last year and a half, 2 years, we've been, you know, kind of up and down, learning about the process and the programs and what they're gonna have available for our members of the community, and making sure that we're all okay with what's going forward. And, you know, they've answered everything, and, you know, I think this is great having these weekly meetings that we've been going back and forth, so that way all of our frustrations and uncertainties are answered, and making sure, you know, our members are taken
And
care
it
of.
could have an impact on the long town with the village police.
Well,
and the rest of us.
right, and we've had the chief involved, and our PD's been involved, and we'll continue to keep them at the table with the conversation. And a property that's been burned down for so long, a whole block is gonna be taken care of. We don't see anybody else coming forward spending that kind of money, and so if we can all work together to, you know, for the betterment of the village and the town and the county.
Main Street, huh?
Main Street, yeah. They're gonna put businesses on the first floor, and we need housing, and we all know we need housing, and we're constantly looking for places for people, so.
I think it's better, so we can pick and choose when we take. Ed,
When are you guys gonna start? What do you need? You need us to block traffic? What do you need? I'm all for it. You guys have done a lot of work and I appreciate you coming just to, let's get everything out in the open and let's get this moving down the road. Get it done. I appreciate it. Thank you.
I'm gonna go to Paul Marone next because he's sick, so, okay? Not to put you last on the.
I've always been a favor, as long as the local rep and legislators from Malone are satisfied with it. I am. It's a great support for not only Malone, but for the whole county, and I'm sure it's going to move along well. Thank you.
Thank you. I think,
I'd echo the same in terms of as long as it is in line with what representatives from Malone are interested in, it'll be a very valuable project. Yep.
and I'll go last. I just think it's great that because it's gonna pick up a bad part of the town that's never gonna get taken care of otherwise. It's great that somebody's looking at it and gonna do something with it. And as far as I'm concerned, Ed, we do to help. We're here to help. But we just have to make sure it's done the right way.
Absolutely, and we're asking for a letter from DSS who are committed to addressing any concerns that you have. If you want to continue to catch up offline, we can.
I do, I welcome that, and I think that the communication will be the key, now and through, the rest of the project, so I appreciate that.
I think that our approach has changed in terms of putting out updates. Before it was we weren't going to engage unless we had an update. Now let's put something on the calendar, and even if we have no update, we can still say no update. Are there any questions? And it'll give us a vehicle to address, discuss, anything that folks want to discuss.
Is there gonna be any demolition prior to you getting the rest of the funding, or?
We're still exploring those options. The big thing is, these are citizen applications now. We intend to do something.
Done? You own them?
We own them. We own them.
No,
We have a building next door with the same stone, if you want to start your stone. You can clean it out and start your stone.
No, we own them, and we want them gone as much as the rest of the community.
But you did plan on saving the stone and things like that.
From Gorman, yes, and some of the cornice work from the other historical buildings. I mean, we spent the first portion, a ton of time on what it would look like, because we wanted this to match the community. We wanted it to fit. It's a keystone property in our community. It's the gateway to both Titus Mountain and the Malone Golf Course for people who come in from out of town, especially from the north. So we wanted to make sure that this stood out and was in fitting with the community stuff.
So John was saying we own that old railroad.
So if you guys are in the building mode and you'd like a great building to store stuff in, we give you a great price.
It's made out of the same stone.
Yes.
we do have some holes in the roof, guys, like just,
But-
full disclosure, you would
We're
have to
talking stone,
tolerate
we're
the
not
rain.
talking-
The building we have has no roof.
But it'd be safe and secure in there, because there was a beer distributorship, and there was pork trucks in there and things like that, so it has a solid floor. And things like that.
Really appreciate that.
When you get done storing, you can take the building.
Maybe more stone. Is there anything you'd like to say in closing, or?
We just look forward to resetting our relationship, reestablishing the discussion. We're all in this together. It takes the entire community, and whatever we need to do to earn your support, we're interested in talking about that.
Yeah, I think it's gonna be good having some people from this room and I'm sure that are gonna be part of that discussion, so those issues don't come up later on. And hopefully it'll be a good working relationship.
When do you need the letter? What's the deadline?
I don't,
Because it's about the same time as last year. I think Lindsay was driving to Albany, right, with her
Yes.
packet.
I'll get back to you on that.
Well, get back to
I don't think
Michelle.
I don't think that there is such an urgency this year. That's one of the things that we're trying to do, is give folks time to ask questions around our requests and our updates. But there is a process. Everything's been thrown off because of COVID funding. I'm sure you guys
Yeah.
know this across every state agency you work with and your own municipalities, but right now, in the next 30 days.
Is there an application date for the HHAP one, James?
Not yet.
There isn't.
Not yet, but the homes and community renewal, after weeks of the state telling us that they didn't know if there was ever going to be a funding round, it actually came out with very little fanfare last Friday night. So we were contacted by HCR on Saturday morning and said, this is where I'll go. So
When's that till?
August 26th.
And Eastside, are you going after Eastside too?
We just continue to get.
Oh, you
approved
have
for
that
Eastside.
already.
Eastside is an Empire State Supportive Housing Initiative. That's where this idea came from. It's the supportive housing, the funding for supportive housing, and the care model that's attached to it. We've been approved for that 4 years in a row, and they are in touch with homes and community renewal and Office of Temporary Disability Assistance and Empire State Development. So all of our funding sources are working together to evaluate this project.
So it's really just then the HHAP grant that would be in addition to what you currently have?
We need the homes and community renewal
Okay.
funding, which is about $12 million in tax credits. It's a quick calculation, but it's tax credits. It's the largest funding piece that we will apply for housing and homelessness assistance money to build that.
There's a lot of money out there on that money.
Yes, and we were worried when COVID first hit, how this would impact. But when we looked at the last major economic downturn in 2008, the government put a ton of money into supportive housing and housing assistance. So we believe that because this project provides safe, stable housing for the community, community, it's shovel ready for the government to evaluate. So we think that we're in a good spot.
Well, I don't think we have anything else. I think we're good. Thank you very much for coming in, and we appreciate it. And hopefully the communication will keep going forward and we'll keep moving forward.
Thank you.